Hi, my name is Macy Augustine, and today we're going to be talking about Meredith Grey. Meredith is the main character in Grey's Anatomy, and she's a general surgeon at Graceland Memorial. She was born in Seattle, Washington, and raised there except for a brief stint where she lives in Boston. She is serious about her success as a surgeon, and she wants to keep the legacy of her famous surgeon mother, Ellis Grey, alive. She faces a lot of comparison from others to be just like her mom surgically, which makes her feel like she's invisible sometimes and like she's not her own person. Meredith has faced a lot of trauma and hardship throughout her life, including issues with abandonment from her mother. Her mom was a great surgeon, but not so good of a mom. And she survived lots of shootings and bombings, which has been hard on her. And she also experienced the deaths of many loved ones. Meredith works almost every waking minute of the day as a resident, and she gets very little sleep because of this, which would not be considered normal in most other careers. And there's a lot of drama in the hospital with love interest, and Meredith's family life is a bit rocky. I'm diagnosing Meredith with major depressive disorder. A little bit about the disorder. So patients are going to experience a depressed mood most of the time, with intense, persistent feelings of sadness most days for the entirety of the day. She's going to have a loss of interest in usual activities and things that she would normally like to do. There will be a presence of suicidal ideation in some patients, and the patients will either be sleeping or awake most of the time and can also experience weight loss or weight gain. It's totally individual to the patient which one they experience, though. So, about the culture in the show, it's normal for doctors to feel deep sadness because they're overworked and underpaid. I think that the therapist in the show that she would be seeing would not think anything of it because of the hospital culture. The therapist also would be experiencing the same culture, so it would be considered normal. I don't think she'd be taken very seriously, and I could see them diagnosing her with anxiety or putting her on a few days of mandatory leave at the maximum. Depression is not widely accepted across all cultures. In fact, bigger countries like the United States and Australia are better about expressing signs and symptoms of depression, and smaller countries tend to suppress it and don't think much about it. In the United States, there are a lot of negative stigmas around depression, and people are labeled as weak or attention seekers if they express symptoms, and it makes people not want to speak up when they feel depressed. An empirical article published by Cambridge University says that culture plays a significant role in the recognition of depression, and Western societies have a much easier time with recognizing it, even though there is a negative stigma. This affects the recovery and the view of people with depression around the world. There's a lot of evidence that Meredith has depression, but namely suicidal ideation and persistent sadness are things that are flagship. In season 3, Meredith falls into the water trying to save the life of a little girl, and instead of fighting for her life or swimming out, she gave up. She was found unresponsive and was revived, and when asked why she didn't call for help, she said that she simply gave up on her life and didn't want to live anymore. Meredith was clearly sad and desperate in the episodes leading up to this moment, and this is one of the most compelling pieces of evidence that supports her passive suicidal ideation. Meredith also talks to her best friend Christina about feeling dark and twisty inside, and she's consistently used this term to describe the sadness that she's feeling. Meredith confides in Christina and her husband Derek a lot because there are many times when her life feels too heavy to bear. And she's withstood a lot of hardship, and her emotions have been deeply affected by this. One symptom that Meredith does not have is the inability to think or generate new ideas. She tends to put her personal life and feelings aside for the better treatment of her patients. She's able to innovate and do things and be a good mother, and this is effective until she goes home at night and is by herself, and then she breaks down. The DSM says that a symptom that classifies depression is the inability to think or concentrate, and that cannot be seen in Meredith. And the CDC also says that most people who experience the symptoms of depression don't experience it in its most severe form. Only 2% actually feel so severely that they lose all motivation to live and generate new ideas. If I were Meredith's psychiatrist, I would want her to attend psychotherapy. The goal of this treatment method is to rehash childhood and past traumas in order to train the unconscious to move past it. She has been put in many high-pressure situations, and this is something that could help her mental health drastically. An ethical concern is the potential for a breach in confidentiality for sure with the therapist. And Meredith also doesn't like to talk about her feelings, so she may feel uncomfortable with this treatment, but it would be good for her in the long run. According to Science Direct, psychotherapy is effective in treating cases of depression, and the probability of an effective treatment is greatly increased when the patient is provided with skills they can cope with the daily stress of life with. In Grey's Anatomy, a lot of characters experience depression at one point or another, and I think Meredith's case is probably the most accurate when it comes to depicting what depression actually looks like in most people. She's high functioning and motivated to fulfill her duties as a surgeon and a wife and a mother, and it doesn't pause because she's depressed, which I think most people can relate to. The show has a way of depicting mental disorders and medical disorders in general pretty accurately to begin with, so Meredith's depression is not an exception. Her sadness and suicidal ideations are things that actually show up in patients who have depression outside of the realm of cinema. And I think this film shows the culture of residency and internships in hospitals across America pretty well. The hours that residents put into training and work each week are considered unethical and unreasonable in most other fields. And they run on little sleep, have fried brains, and don't spend much time out of the hospital walls. And I think because they work in such an intense environment, her behaviors in depression is not recognized in the way it should be. And a lot of doctors also have depression outside of cinema too, so it's normal to them. In other cultures and working environments, this would not be seen as normal, and most jobs would probably send her to a doctor to ensure her well being. I think in some countries they would probably view Meredith's depression with the same lack of regard that the hospital does, but in most of mainstream America, her behavior would be considered disordered. Thank you so much for listening to my video, and here are the sources that I used for the diagnosis and the citations that I used for treatment as well.